You can prevent Alzheimer's disease. There is a huge body of evidence now showing the causes of the effects. And over the last 5 years, there's been so much that's been gathered around the gut. And it appears now that the gut is the single biggest factor when it comes to Alzheimer's disease. And what's great about understanding that is that once we start to fix the gut, we fix lots of other issues we have out there as well, which I'll get onto in a moment. But none of us want Alzheimer's disease. And in fact, if you're 30 or even 40, you're probably not thinking about it now. But at 45 and 50, you go, oh, I'm starting to see some people out there who are getting it, my parents and so on. And you start thinking about it. So now it's a great time to start preventing it. Not waiting until you're 70 or 75 and you're thinking, okay, my memory's going. It's about now. It's taking action now. Because as you'll see, it has so many other potential benefits, in terms of your overall health and well-being and lowering all of the various forms of diseases and so on. So let's look at the risk factors. And these are the major lifestyle and other risk factors. It starts with aging. There is no doubt that age plays a big role. And the first part about that is when you're about 65 to 69, it's 1 in 80. That's a couple of percent, okay? When you're greater than 85 years of age, it's 1 in 4. Now, don't start trying to fix it then. Start right from the beginning. And this is where we know, you go, well, why is aging linked to the gut? Well, all of the research over the last 30 years on gut health shows that the gut actually deteriorates. The microbiome, which I'm going to be talking about, goes into a state of increasing dysbiosis as we age. And the ones who live longer are the ones who maintain their gut health up here, and the ones who die. Now, this is the same for lots of other conditions, but also with Alzheimer's disease. So as we age, our gut deteriorates, our gut microbiome deteriorates, it gets worse. And as a result of that, we become more susceptible to Alzheimer's disease. So let's start looking after our gut. Now, then we get on to, so gut aging, we can actually influence maybe not our chronological age, but our gut age we can influence. And I actually have a video on that, so double check on the videos there. Now, remember, you don't want to get Alzheimer's disease, so let's start taking action now. Check out the videos on reversing the aging gut. Now we've got genetics, and genetics plays a relatively small role. For the last 50 years, we've been told it's all in the genes, it's all in the genes. Rubbish, rubbish. The only gut illness in the genes is diarrhea. Sorry about that bad joke. But what we do know is the vast majority of illnesses are caused by what we do to the genes, epigenetics. Now, in Alzheimer's, there is a gene, ApoE4 in particular, which does increase susceptibility dramatically to Alzheimer's. And that usually is in the early onset dementia before 65 years of age. And that occurs in a small percentage, probably 1 to 3, 4, 5% of the population. So a relatively small amount. And by the way, we can do things to reduce that as well. So that's what's great about it. But if you're 75 and 80 and you're thinking, okay, my memory's going, oh, my friends had it, my dog had it, my wife and everyone else had it, it must be genetic. No, it's epigenetic. It's what you're doing to your genes. So take control, take responsibility for your health. This isn't something you can farm out and get a bit of advice. This is something you will learn from. And so we've got sedentary behavior. Get up and move. All the research shows, and you go, well, what's sedentary behavior got to do with the gut? Hold on. There's a lot of research showing the more active you are, the healthier your gut. The healthier your gut, the more active you are. It's a what they call crosstalk or a feedback loop. And so all of the research shows that even if you are eating some crap food out there, some typical Western foods, exercise counteracts that in terms of gut health, which is a great reason why everybody needs to get up and just walk. I've got, again, a great video on the benefits of walking. So have a look at that because it really gets you motivated to start taking some extra steps. But it can be anything. Just get off your butts and start moving. And then we've got diet. We all know the role diet plays, and I'm not going to go into that because, again, there's so much information on my YouTube channel. Stress, sleep, and even upset circadian rhythm. That is, even if you're a night shift worker and you're getting lots of sleep, your circadian rhythm is out of balance. And that, sleep and stress all show and play an impact on gut health, and has that feedback loop, that crosstalk again, and shows that we actually, it then makes you sleep worse and stress more, and vice versa. You've heard of the gut-brain axis. Well, I'm teaching about the gut Alzheimer's axis today, and all linked in. Smoking, alcohol, even antibiotics. Now, that's interesting. Why would antibiotics, if you consume, the more antibiotics you consume in your earlier life, the greater your risk of Alzheimer's. Hold on. Why? Because the antibiotics, without reversing the detrimental impact of the antibiotics, without reversing it, then you're having a state of dysbiosis for a large part of your life, which is setting up the mechanisms for Alzheimer's. Alzheimer's does not begin when you're 79 and you get it at 80. It begins when you're 40 and 50 through your habits and what you're doing. So antibiotics. And then there's another one, laxatives. Even the use of laxatives, regular use of laxatives, increases your risk of Alzheimer's disease, as well as many other conditions. So hold on, how? Because it all goes through the gut. You see, I see the gut as a unifying theory about Alzheimer's disease. And if we start to fix the gut, the simplest strategy, if we just start to fix the gut, we fix all of our health, many aspects of our health, and we start to dramatically reduce our risk of Alzheimer's. Then you've got toxins and pollution. And there's an interesting one I thought I'd put down here. Education. All of the research shows that education, the higher level degree you got, reduces your risk of Alzheimer's disease, hypertension, early death, a whole raft of these conditions, okay? And you're thinking, is it because the brain expands? No. The research actually says that's not the case. It actually shows, and we were involved in some of this research 30 years ago, when you have a higher level of education, you're more willing to learn and experience and question and keep growing your experiences. In other words, you're learning about health. So you're fortunate, whether you've got a degree or not, you're already learning. And as a result of that learning behavior and the willingness to learn, you're learning what are the next things you can do to reduce your risk of these adverse health conditions. So education plays a big role, and that's why you're here. And that's why we need to get this information out there as much as possible. So they're the major risk factors. Then we have our medical risk factors. And these are the four main ones. Again, there are many minor ones in there, but hypertension, high blood pressure, is a risk factor for Alzheimer's, a major risk factor, as in diabetes and uncontrolled blood sugar levels or insulin resistance, obesity and depression. And all of these four have been linked with gut dysbiosis, a dysfunction of your gut microbiome. And they've shown studies where in hypertension, for example, they can get mice that are hypertense, take the gut microbiome, put them in healthy mice, and they become hypertense. And they've done the same with diabetes, obesity, and depression in mice, and they've even started some experiments with humans out there. So we know that the gut plays an important role of all these. And that's what's great about this unifying theory about your gut Alzheimer's link, is that once we start to fix it, we start to improve these, and we start to reduce the risk of those as well. It's a win-win-win. In fact, so many wins, it's ridiculous that everybody isn't doing it. And then what we find as a result of all these over here, they lead to gut dysbiosis. We then have all these ones here leading to gut dysbiosis. But, like the ads say, there's more. We also know, see, I'm trying to convince you, what I know is as close as fact as you can get, is that the gut is the most critical component of Alzheimer's. And then we've got things like periodontal disease, tooth decay. If you have periodontal disease, tooth decay, gum infections and so on, if you have reflux, if you have small intestinal bacteria overgrowth, if you have IBS, irritable bowel syndrome, or even if you have your appendix out. These aren't all, these are just the major ones I've listed here. They all increase your risk of Alzheimer's, dementia, gut dysbiosis, and so on. So the picture is so clear. And this is only half the picture. In a few minutes, I'll show you the other half, the positive side that works via improving the gut and how it's been shown to improve Alzheimer's. But we go here. So how does it occur? Well, quite simply, and it's not simple when I try to read all these studies and so on, and there are hundreds of studies on it now. We find that the gut dysbiosis creates toxins. So the wrong bacteria in your gut out of balance, they're called the opportunistic species because they take the opportunity to take over. And when these opportunistic species take over and start producing their metabolites, and when they die and produce waste material, they produce a whole raft of gut toxins. Two of them are LPS, and another one is called amyloid plaques. Oh, hold on, you've probably heard of that because that's the stuff linked with causing Alzheimer's in the brain. So your first thought then is, okay, is it linked? Yes, it is. And we know that these toxins here, first of all, create leaky gut. So things can get out of your gut, literally out of your gut, things that should be in your gut and stay there, into the blood and circulate around the body and cause poison. That's what causes arthritis and joint pain and all those other conditions we've got out there. And it's leaky gut. And these toxins are the things that cause the leaky gut. Now those toxins also, when they get in the blood, go up to the brain and cause leaky brain. You have a barrier around your brain, what's called your blood-brain barrier. And it's supposed to stop things getting in and allow the good things to go in. Unfortunately, if you've got a leaky gut, you've probably got a leaky brain because it's made out of the same tissue, your connective tissue. And as a result, you've got a leaky brain. Things can get in, it shouldn't. Things get out when they should be staying in there. And as a result, you've got oxidation in the brain, you've got neuroinflammation in the brain, and you've got a build-up of plaque, these amyloid plaque and something called tau, fibril, the whole raft of these things going on. Now, I have another theory, and this is my personal theory, is that these are the body's attempt to stop the inflammation doing the damage. So they're kind of, in a sense, preventing immediate damage and postponing it. But in the meantime, what they're doing is causing long-term damage. So what we want to do is stop this happening right from the beginning. We need to stop it. So we've got this picture, all these contribute to gut dysbiosis, and then that leads to Alzheimer's and dementia. Now, knowing that, you've already got some things that you know you can start right now. That's the great part about this. All the things you've been told, or most of the things you've been told, are literally what you can avoid to reverse some of these conditions, what you can do to reverse some of these conditions, and it all starts working through the gut. You may not yet be fully convinced that the gut is where we need to put all our energy. Well, let me show you the compelling evidence, because all of the information I've shown you so far is kind of the things leading up and pointing to it and directing to it, but now comes the really convincing evidence. I want to reiterate, first of all, we've got the active, educated lifestyles lead to healthy gut, lower inflammation, lower antioxidants, and the Alzheimer's prevention program. So how do we get to a healthy gut? And how do we test this hypothesis that it is the gut that is where we need to put all that focus? And I want to start from the bottom of this list. Then metformin is a pharmaceutical that's well known in diabetes. A lot of diabetics take it. It's extremely effective. And what we know of that drug is that it actually lowers the risk of Alzheimer's. Now, what we also know about it with diabetes is that it works essentially by altering the gut microbiome. Yep, if you inject it, it doesn't work. Taking it a tablet to get into the small intestine, it works. If you give it if you give it to mice who don't have any gut bacteria, they're called no-biotic mice. They've been sterilized on the inside. And if you do that, then literally the metformin doesn't work either. So we know the metformin works with the gut bacteria to reduce insulin resistance, diabetes, and Alzheimer's. So that's the first one, a little one coming from a pharmaceutical industry there. Now, do I recommend taking it? Obviously not, because there are so many better things that we can take. Then we've got some more evidence, what I call Prebiotics. We see from the evidence that vitamin C, D, and E reduce the risk of Alzheimer's disease. Now, there are many studies now showing that people who have Alzheimer's have lower rates of nutritional levels. And we also see studies on mice and rats now showing these. Now, are there the double-blind placebo-controlled studies? Well, no, not yet, because they're not done with nutrients because of the fact that you can't patent them. However, my first suggestion, and this is giving you some hints along the way here straight away, is in your own program, make sure your levels of C, D, and E, these two are fat soluble and they'll last in the body. But vitamin C, I take every single day, okay? I take 2 to 3 grams of it every single day. Now, these are the Nutribiotics. They're not the only ones. I'm going to show you more in part 2 of this program. And these Nutribiotics lead to a reduction in Alzheimer's. They lead to an improvement in gut health, anti-inflammatory, and Alzheimer's. Then we've got what we call the phytobiotics. And the phytobiotics are those ones that you read about all the time. People are saying, oh, green tea, new evidence showing green tea lowers the risk of Alzheimer's, improves memory, improves cognitive function in people with Alzheimer's and so on. So some of the human studies are done on these, and lots of animal studies and cellular studies and so on. And these are the things that are coming from plants, which means phyto, and biotics means in the gut. These stimulate the production of different healthy, what we call commensal bacteria in the gut. And they push aside the negative ones. They get rid of some of the bad ones, okay? So it's green tea, things like turmeric, resveratrol, which everyone talks about in red wine, but there's not enough in red wine to be of any benefit. And things like blueberries, blueberry extract, but I'm going to go into more detail, as I said, in part 2. But again, a little bit of a hint, if you want to get into the program right now, that's enough to get started. Now, how this works with a double-edged sword when you have these phytobiotics is that if you have green tea, you will only absorb 6% or a small percentage, 5, 6, 7, 8% of these green tea active ingredients. Now, that sounds good, but wouldn't you like to get more? So what happens is when you have green tea, these active ingredients stimulate the right bacteria to reproduce, and these right bacteria are then making the green tea extracts more available. They do it with the blueberries, turmeric, resveratrol, and all of these. See, they enhance the availability of all the nutrients in the body. So the right bacteria in the gut enhance the availability of the nutrients. So you can get up to 50, 60, 70, even 90% of the green tea extracts absorbed simply because you're having it on a regular basis. And this is why most programs don't work for people. Oh, I've got to do something for my Alzheimer's, I better do it. And they do it for 3 weeks and stop. It doesn't work. Your gut microbiome takes days, weeks, months, years. It's a lifelong journey. That's what I'm saying. Start now before you actually get signs of Alzheimer's or some preclinical signs and things like that. So this green tea is converted into something, the body can use it, more of it. It provides the food for the good bacteria. So that's why it's called phytobiotics. It's feeding the good bacteria. It's a win-win-win situation. And I've got more on that in my other videos on gut health. So again, check them out, because if you really want to, Alzheimer's proof your brain and your body, then what you need to do is understand the gut, the ins and the outs, and you'll get the best information on that in the videos that I actually have when you subscribe. There is so much good information. This is just the little bit of the Alzheimer's icing on the cake. So we know those, the phytobiotics. Then we also, so we know the phytobiotic, all of them lead to improved gut health, and all of them anti-inflammatory, antioxidant, and lead to a reduction in Alzheimer's prevention. So there are lots and lots of studies showing that, okay? Mostly animal, but some human clinical trials too, small trials done over 12 weeks. Imagine what would happen if you're doing them over 2, 3, 4, 5 years, the rest of your life, which is what I'm suggesting you do. Then you've got prebiotics, and prebiotics are the food of the microbiome in your gut. So you feed them. And these are really the fibrous things that we can't digest, a little bit like the phytobiotics, but they've separated them out. And these foods, the fibers that go in there, produce or feed the right bacteria, and those right bacteria produce a whole raft of really positive nutrients that go into the body, and I'm going to show you some of those in a moment. And or they, as they metabolize them, because it's only the good bacteria who can metabolize them to produce these good ones, and they also poison the bad ones. So it's a great way of getting rid of those opportunistic species which cause or contribute to Alzheimer's. At the same time, rebreeding, refeeding, what I call rewilding your gut with prebiotics. So prebiotics are an essential ingredient. That's why fiber consistently shows up as an inverse or a negative effect on Alzheimer's disease. So it reduces the risk of Alzheimer's, as do the studies on prebiotics in short-term trials, again, 12, 16, 8 weeks and things like that with humans, and the longer studies that are done on mice and cellular studies as well. So we know that all works. Healthy gut, anti-inflammatory, antioxidants, and reducing the risk of Alzheimer's. Then we get on to, here we go, so we're getting more convincing here. You're still not totally convinced. Well, the studies on probiotics, and probiotics are really the area that everyone thinks, okay, I'll just take probiotics. No, probiotics work best when they're combined with all of these. See, a lot of people say, I'm going to take probiotics, but if you're taking them and you're not feeding them when they're down there, then you're wasting a lot of your money. And as soon as the probiotic finishes, you're probably not going to have a long-term benefit effect of it. But if you're doing these things, the prebiotics, phytobiotics, and nutribiotics at the same time, and constantly feeding and rebreeding up those good bacteria, then the probiotics are really going to be winning. But it's like a football team. The probiotics are the goal shooters or the goal kickers, and the rest of these are the football team that support it. It needs all of these to be really effective. So take probiotics, absolutely. And the two major species that come up in the studies again are the lactobacilli or the lactobacillus and the bifidobacterium. And these are the ones you get in the yogurts and in most of it. And at the moment, there is no specific probiotic for Alzheimer's, okay? It's just not there yet. There will be, in 10 years, there'll be specifics, and they'll be able to tell you if you've got the wrong bacteria in your gut that are going to cause Alzheimer's, and you do something about it early in life and so on. But the message here is just by supplementing daily or at least every couple of days with these and doing the rest of this, you're going to create a healthy gut, anti-inflammatory, antioxidants, and the studies show that probiotics are effective. And there are dozens of these studies on humans showing that supplementation with various probiotics, just even over a short period of time, 8 weeks, 10 weeks, 12 weeks, and so on, probably the longest I saw was about 16 or 20 weeks, all showed improvement in gut health, lower inflammation, oxidation, and of course, improved Alzheimer's symptoms and signs and preclinical conditions. Wow. Now, getting pretty convincing, isn't it? So something as simple as probiotics taken every day. Now imagine if you took probiotics with these things that are going to support it. Now here comes the most convincing part. And this is called the washed microbiome transplant or the fecal microbiome transplant. In other words, they grab some feces from, in this case of mice studies, okay, there have been a couple of individual clinical situations where it's worked, but they take the mice and a mouse with, or the mice with Alzheimer's. So they've created the Alzheimer's in the mice, they bred the mice and the created conditions create the Alzheimer's. Usually by probably giving them lots of junk food and so on to create it, which we know, and inactive, and they get Alzheimer's, and then they take the microbiome, so they take a sample of the poo from the sick Alzheimer's mouse and put it in a healthy mouse, and the healthy mouse develops the signs and symptoms of Alzheimer's. Wow, hold on, you serious? And then they take the poo from the healthy mice and they put it in the Alzheimer's mice, and the Alzheimer's mice start to improve. Wow. Now, if that's not convincing enough, this is kind of I've left the biggest part right for now to get you to understand that this is absolutely convincing. The gut plays a huge role in Alzheimer's. So all of this is the background to it. That's the convincing evidence. And there have been clinical individuals who have been treated in this way. I can't find any big clinical studies on it at the moment, but there will be in the next couple of years. I guarantee that. Because everyone's excited about the role of gut. All the science world out there is excited about the gut Alzheimer's link. And so with the individual clinical situations, it's shown to be effective. Now, would I recommend that for you? No, I'd recommend you do all this stuff, which is what I'm talking about. And so we come back to it. We know this works. So why does it work? I want to finish up very, very simply by explaining why it works. And that is, we're after a healthy gut. We know the active, educated lifestyle. And I'm going to reiterate that word there, educated, okay? Look, educated is not because you've got a degree. Educated is because you have developed skills in learning and you want to pursue it and you want to get more information. And that's what my YouTube is about. So make sure you subscribe, share it with your friends, and get them active and get them thinking about this. The gut is the the major contributing factor and solution to Alzheimer's. So why does it work? Well, we know the healthy gut, when you've got the right microbiome, it produces a whole raft of chemicals in there. Hundreds of chemicals. And those chemicals are anti-inflammatory, antioxidant, and they lead to Alzheimer's prevention. But what are they? Well, there's a group called short-chain fatty acids. I'll go through these quickly. If you don't have any science, that's fine, just ignore it. But they have these short-chain fatty acids, and the main one is butyrate. Butyrate has actually been shown to be anti-Alzheimer's already. So they know that the fermentation of fibers, prebiotics, by the gut produce butyrate, and butyrate is anti-Alzheimer's. Wow. Then we've got another one, gamma-aminobutyric acid, serotonin, melatonin, dopamine. All these ones here are the ones involved in the brain and nervous system function. They've got other functions around the body as well, but the brain and nervous system function. Serotonin, obviously, and dopamine in terms of how we react, respond, and feel about our lives. Hence, a link with depression and depression and Alzheimer's and sick gut. Then you've got something like melatonin. Melatonin is the sleep neurotransmitter, and we find that the gut improves melatonin. In fact, the gut produces about 400 times more melatonin than your actual pineal gland that controls your sleep cycle. So it's so important. And melatonin is one of the most potent antioxidants in your body, and it works at a cellular level to actually repair cellular damage. Now, isn't that what you want in this case? And so then we've got all these acetylcholine, histamine, glutamine, which is in terms of gut repair and repair of your blood-brain barrier, that barrier around here. So these and many, many, many more are produced by the right bacteria, not the toxins as I showed in the first slide, but the good bacteria producing the good nutrients, which have all these benefits here. And that includes things like the right bacteria produce vitamin B2, B9, B12, which are essential for nervous system health, which is your brain and your Alzheimer's brain, and vitamin K, which is critical for blood and overall health. So my message is really simple. The evidence here is very, very clear. We know that the gut is the driving force of Alzheimer's now. You can wait around for 10 years for the health professionals out there to start telling you and waiting for that, or you can start to act now, because the great thing about this program, and that I'm going to show you in part 2, the great thing about this program is anti-hypertensive, anti-insulin resistance, anti-diabetic, all of these chronic illnesses that we're suffering from. We have a health crisis at the moment. It's not a crisis of information, it's a crisis of action. And so I'm calling everyone to action, to actually watch those other videos, check out part 2 and take some action about it, because we can make a difference with Alzheimer's.